Hello, I am Dr. Vikas Gorhe, Gynaecologist, fertility specialist and Laproscopic surgeon, Nashik. Today I will be talking in this video on very important topic, that is diet and exercise in pregnancy. As far as the diet is concerned, almost all the ladies who comes to us for the treatment during their antenatal period, they ask, sir, which food we should eat and which food we should avoid during the pregnancy. At the same time, they are very much interested about their physical activity and exercise during the pregnancy period. As far as diet and exercise is concerned, these two are very important as far as promotion of healthy pregnancy and good delivery or a normal delivery of the pregnant lady is concerned. In the diet, there are 6 elements which are very much important. These are, first is folic acid, then calcium, iron, protein, carbohydrate and fruits and vegetables. We will be talking firstly on the folic acid, which is also called as folate, and which is important part of the vitamin B12 group of the vitamins, which is required for the development of the brain and the spinal cord of the baby. If the mother is having less quantity of folic acid or folate deficiency, there are chances of brain abnormality or spinal cord abnormality in the baby, that is called as open neural tube defects. So in order to avoid these defects, folic acid is the very important substance which should be there in diet of pregnant lady. Sources for the folic acid are the green leafy vegetable, fresh citrus fruits like oranges, tomatoes and various non-vegetarian foods like chicken and fish. Also it is available in some amount in beans and nuts. So these are the sources of folic acid. We doctor also prescribe the folic acid tablet in our prescription as per during the pregnant ladies treatment. Second most important ingredient of the pregnant ladies diet is the important one is calcium. So mother should consume lot many substances which are rich in calcium. Requirement of calcium is there for the formation of bones and teeth of the baby, and if it is not fulfilled by the dietary source, then the calcium is drawn from the mother's bone and mother's demand is for the calcium is increased. In the pregnant lady, the demand of the calcium is almost 1000 to 1500 milligrams per day, which should be fulfilled in the diet which is rich in calcium. If it is not fulfilled, then we doctor prescribe as a supportive measure in order to fulfill the requirement few of the calcium tablets. The rich source for the calcium is milk and milk products, then the non-vegetarian foods like eggs, then chicken, then mutton, then the fish, and it is also available in some fruits like banana, then pineapple. These are the rich sources of calcium which should be incorporated into the diet of the mother. Third most important ingredient of the pregnant lady's diet is the iron. Iron, which is required for the synthesis of hemoglobin, and as you all know, hemoglobin is a very important substance, important ingredient in the blood, which is important for the oxygen carrying capacity of the mother. If there is a less oxygen carrying capacity, mother feels weak, fatigue, and she is unable to carry out her day-to-day activity. At the same time, she becomes more prone for the infection, and baby also suffers from the intrauterine growth retardation. So in order to fulfill this extra demand, which is almost double than the non-pregnant state, we have to consume or we have to prescribe a diet which is rich in iron. So the sources for the iron in diet are jaggery, then pineapple, then apple, then all sorts of green leafy vegetables, pomegranate, and all non-vegetarian foods like chicken, then fish and mutton. These are the rich sources of iron which should be taken in adequate quantity during day-to-day diet of the pregnant lady. In order to fulfill this extra requirement, we doctor often prescribe iron tablets or the iron tonic to all pregnant ladies. Fourth important ingredient of the pregnant lady's diet is protein. Proteins are the rich source of amino acids which are required for the bodybuilding of the mother and the baby which is growing inside mother's womb. At the same time, proteins are required for building the immunity of the mother. In non-pregnant ladies, the requirement of the protein is 50 gram per day is the requirement, which increased to the 70 gram per day, which is definitely having a high demand of protein. So this demand of the protein which should be fulfilled by the diet which is rich in proteins. This requirement is especially increased in second and third trimester, during which the baby's growth is fast. Rich sources of the proteins in the vegetarian diets are milk and milk products, various pulses, various nuts, dry fruits, then the soya paneer. These are the rich source in the vegetarian diet. In the non-vegetarian diet, then eggs, chicken, fish and various non-vegetarian foods, ingredients which are the rich sources of first class protein. So this requirement should be fulfilled in adequate quantity in order to have a balanced diet of the pregnant lady. Fifth important ingredient of the pregnant lady's diet is the carbohydrate. Carbohydrates are required for giving the energy to the mother for her day-to-day activity as well as metabolism. The complex form of the carbohydrate which is available in whole grains, which is the best for the pregnant lady. This complex form of the carbohydrate is available in various whole grains, and these are very much important in relieving the first trimester nausea and vomiting, which can be tackled by giving these whole grains biscuits, then crackers, then the oats and brans. These kind of carbohydrate food which is very much relieving and soothing for the pregnant ladies first trimester nausea and vomiting. At the same time, this whole grain carbohydrate which is complex, which is rich in fibers, which is very important for relieving a constipation in second and third trimesters, which is the very commonest complaint of the pregnant ladies in the latter part of the pregnancy. Sixth most important ingredient of the pregnant lady's diet is fresh fruits and green leafy vegetable. These fresh fruits and green leafy vegetable provides vitamins, minerals and the antioxidants which are required for building the good immunity and good growth of the baby. These fresh fruits and green leafy vegetables can be opted from the bananas, pineapple, apple, strawberries, then sweet potato, carrot and spinach. These are the sources which are easily available in the market, and this can be taken in daily meals in adequate quantity and adequate portion, as these fresh fruits and green leafy vegetables are the rich source of the fibers, which is also important in relieving the constipation, which is the most common complaints and of the pregnant lady. So this is also an important part of the pregnant lady's diet. At the same time, they should avoid a few things, which is alcohol, caffeine and raw meat. At the same time, unpasteurized milk and unpasteurized food products, which can make them susceptible for the infection, which can be very harmful for the pregnant lady's health. At the same time, they should drink adequate amount of water, that is at least 2 liters per day they should consume, which is the important requirement for the day-to-day diet of the pregnant lady. At the end, what they should consume is the balance of all these 6 elements, and if they take this balanced diet in day-to-day routine, then they will definitely have a healthy baby and a good pregnancy outcome.